Okay, let's unpack this. Imagine your gut, that bustling inner world of microbes, suddenly becoming a strategic ally in the fight against cancer.
Hmm.
Sounds like something out of a futuristic medical drama, right? Well, today we're diving deep into some truly fascinating research that suggests exactly that.
It's a remarkably novel concept indeed. Our deep dive today explores a randomized pilot study published in the Journal for Immunotherapy of Cancer that looked into combining oral vancomycin,
Okay.
a very specific gut-restricted antibiotic with standard stereotactic body radiotherapy, or SBRT,
SBRT, right.
for early-stage non-small cell lung cancer patients who weren't candidates for surgery.
And the mission of this deep dive is to shortcut you to being well-informed on how modulating the gut microbiome might, well, dramatically enhance cancer therapy outcomes.
hmm
You'll learn how this approach challenges conventional thinking about antibiotics in oncology and why these initial findings are so exciting, even coming from a pilot study. This is where it really gets interesting. So, for patients diagnosed with early-stage non-small cell lung cancer, especially those who can't undergo surgery, SBRT is a powerful and standard treatment option.
That's correct.
It's excellent at targeting the tumor directly, right where it sits.
That's right. SBRT achieves really impressive local control. But the significant challenge we still face is that the cancer can spread
All right, this is red.
to other regions or distant parts of the body in, well, up to 50% of patients.
Wow, 50%.
And this unfortunately increases their morbidity and mortality. Current systemic therapies, like chemo, aren't typically recommended for these smaller early-stage tumors
Why is that?
because the risks often outweigh the benefits, especially for older patients who often receive SBRT and tend to have more existing health conditions.
Okay, that makes sense.
So finding effective, less toxic ways to enhance SBRT's reach and prevent that spread is absolutely critical. Now, what's truly fascinating here is how the gut microbiome enters this picture.
Yeah, tell us about that link.
Our gastrointestinal tract, with its incredible community of microbes, actually hosts the largest number of immune cells in the entire body. It plays a foundational role in regulating our immune system.
Really? The largest number?
Yes, and we're increasingly seeing that disruptions within this gut microbiome can profoundly influence how well various cancer immunotherapies work.
That's a huge shift in perspective for many of us. We often hear about antibiotics potentially harming immune responses in cancer.
A common concern.
So how does this study propose that a specific antibiotic, vancomycin, could actually enhance it? What's the novel hypothesis here?
It's a great question, and it really gets to the heart of the study. Unlike many broad-spectrum systemic antibiotics, oral vancomycin is designed to stay primarily in the gut.
Ah, okay, gut restricted.
Exactly. It specifically targets a certain group of bacteria, gram-positive bacteria, right there in the digestive tract. This localization is key
Why key?
because it preserves other important microbial communities. Think skin, respiratory tract, the urogenital system.
Yeah.
Those are largely untouched. The underlying hypothesis is that this targeted modulation, this tweaking of the gut microbiota by vancomycin, could selectively deplete certain bacterial types that might suppress the immune system.
Okay, get rid of the bad guys, so to speak.
Sort of, while potentially encouraging beneficial microbes. Essentially, it aims to reshape the gut environment in a way that boosts and supports the body's own anti-tumor immunity.
Okay, so with that crucial context on the gut's role in immunity, let's turn our attention to how the researchers actually put this bold hypothesis to the test. What did their pilot study look like?
Right. This was a randomized, open-label pilot study. The trial registration number is NCT 03546829 for those interested.
Okay, and the treatment?
For the treatment, patients in the experimental arm received oral vancomycin, a dose of 125 milligrams 4 times daily for 5 weeks.
5 weeks.
And they started this vancomycin treatment 1 week before their SBRT began.
Priming the system.
Potentially, yes. The SBRT itself involved delivering 50 grays of radiation across 4 or 5 non-consecutive sessions, adhering to established medical guidelines. Standard procedure there.
Now, the study managed to enroll 17 patients between March 2019 and August 2021. But interestingly, it closed earlier than planned.
It did, yeah. This was mainly due to the COVID-19 pandemic, which, as you can imagine, significantly impacted patient willingness to participate in clinical research at that time.
Understandable.
Right. So for the analysis, they ended up with 15 patients treated exactly per protocol.
15 total. How do they break down?
7 in the vancomycin plus SBRT arm and 8 in the SBRT alone control group.
Okay.
And they had a median follow-up of 3 years. Now, it's important to acknowledge that this is a small sample size.
Definitely a pilot study limitation.
Absolutely. Typical for a pilot study. But the consistency of the patterns they observed gives us strong initial indications of its potential. We have to be careful, but it's promising.
Okay, so let's talk safety. When you hear about combining treatments, especially an antibiotic with radiation, safety is often the very first thing that comes to mind for many of you listening.
It is, and rightly so.
What do the researchers discover about the safety profile of this combination?
That's a crucial first inquiry for any new therapeutic approach. And the good news here is the combination of vancomycin and SBRT was remarkably well tolerated.
That's great to hear.
Crucially, there were no grade 3 or 4 adverse events reported.
Meaning no severe side effects.
Exactly. No severe or life-threatening issues related to the treatment combination.
So no major issues. What were the most common mild side effects patients experienced then?
The most common side effects were mild, grade 1 mostly. 4 patients reported some diarrhea, 2 experienced nausea, and 1 noted fatigue.
Pretty manageable, sounds like.
Generally, yes. There was 1 instance of grade 2 diarrhea and another of a grade 2 urinary tract infection. But overall, the side effect profile was very manageable, especially considering this is a cancer treatment combination.
Okay, good. Now this is where the results truly shine and offer, well, a substantial glimmer of hope for patients and their families.
Indeed. Looking at the key oncologic outcomes, the 3-year local control rate, so controlling the tumor where the radiation hit, it showed a very promising trend towards improvement. It was actually 100% in the vancomycin group compared to 83% for the control group.
Wow, 100% local control.
Now, it wasn't statistically significant, likely due to the small sample size, but it's a strong signal.
Okay, but what was significant?
What was statistically significant and quite remarkable was the progression-free survival, or PFS.
Preventing the cancer from progressing.
Exactly. It was 80% for the vancomycin group versus a much lower 29% for the control group.
80 versus 29%. That's a huge difference.
It is. That's a hazard ratio of 0.42, meaning a substantially reduced risk of cancer progression for the vancomycin group. P-value, 0.049.
Clinically meaningful, for sure.
And perhaps even more dramatically, overall survival, or OS, also showed significant improvement.
The bottom line metric.
Right. It was 100% for the vancomycin group compared to 52% for the control group over the 3-year follow-up.
100% survival versus 52%.
Yes, with a hazard ratio of 0.38 and a p-value of 0.033.
Those numbers are truly striking. A 100% overall survival rate in the vancomycin group, even in a pilot study like this, that's an incredible finding.
It is highly unusual.
But as you said, with such a small cohort, how much weight can we really put on these dramatic initial findings? What are the limitations we need to keep front of mind, even as we feel this, immense sense of hope?
You're right to ask about the caveats, and it's crucial we do. The small sample size is the primary limitation, absolutely. It means we can't draw definitive conclusions for the wider population just yet.
Right. Need bigger studies.
Definitely. However, the consistency and the sheer magnitude of the difference in both progression-free and overall survival are highly suggestive. It's not common to see such large effects in pilot data.
So it strengthens the signal?
I'd say it strengthens the signal considerably, yes. It strongly warrants further investigation in larger confirmatory trials. It tells us there's a strong pattern here. A biological effect seems to be happening, even if we need more data for statistical proof across a broad population.
It really makes you curious about the underlying biological mechanisms driving this.
Oh, precisely.
So if vancomycin was reshaping the gut, what specific shifts did they actually observe in the microbial community that might explain these pretty amazing outcomes?
Well, the researchers found that vancomycin treatment led to a notable decrease in the overall diversity of the gut microbiota. Fewer different types of bacteria overall.
Okay, less diverse. Was that temporary?
That's what's particularly interesting. This change persisted for over a month after the SBRT finished, and it was still lower at 3 months compared to the control group. This was long after the antibiotic course had ended.
So a lasting impact on the gut ecosystem.
It suggests that, yeah.
And drilling down into the specifics.
Yeah.
What changed in terms of the actual bacteria present? Any key players?
They observed a decrease in certain common gut bacteria phyla, like bacteroides.
Okay.
And concurrently, an increase in others, like proteobacteria,
Yeah.
including species like Escherichia coli. So, a significant shift in the balance.
And any decrease in the good bacteria we sometimes hear about.
Yes, crucially, they also saw a notable reduction in specific beneficial bacteria, particularly those from the Lachnospiraceae and Ruminococcaceae families.
And why are they considered beneficial?
These are well known for their role as short-chain fatty acid-producing bacteria, SCFAs.
Ah, the SCFAs. Right, so vancomycin reduced the bacteria that make those?
That's what the data indicates, yes.
So it's not just about what's missing, but how the entire microbial community is changing and how those shifts, in turn, affect the body.
Exactly. The study then meticulously connected these microbial changes to the body's broader metabolic landscape.
How do they do that?
They analyzed both the gut metabolome, so the chemicals directly in the gut environment, in stool samples, and the serum metabolite profiles, what's circulating in the blood.
Okay, connecting gut changes to systemic changes.
Precisely. It allowed them to see how these localized gut changes might ripple throughout the entire system.
And the metabolic shifts were quite telling, weren't they? What did they find?
They were. They saw significant reductions in all the tested short-chain fatty acids, the SCFAs in the stool samples, acetic acid, propionic, butyric, all of them.
Okay, a clear drop in the gut. Did that show up in the blood too?
Yes, in the plasma specifically, there were significant reductions detected in butyric acid and isovaleric acid. These are vital metabolic signals originating from the gut.
Interesting. Anything else metabolically?
Yes, beyond SCFAs, they also noted a decrease in lithocholic acid levels in the serum.
Lithocholic acid. What's that?
It's a type of secondary bile acid. And importantly, it can, in certain contexts, suppress immune responses. So lower levels might mean less immune suppression.
Uh-huh. Okay.
Other important changes included shifts in the tryptophan degradation pathway. Things like kynurenic acid and kynurenine decreased. And alterations in amino acid metabolism, including a decrease in proline and an increase in glycine. So widespread metabolic reprogramming linked to the gut changes. Now let's directly link these profound microbial and metabolic changes to the immune system itself.
Right, the connection to fighting the cancer.
Exactly. The study observed a potent retuning, you could say, of the body's immune recognition processes. It suggests that the body's defenses were essentially being primed for battle.
And the evidence of this immune activation is truly compelling from what I read. What did they see?
Really compelling, yes. They found a significant upregulation of genes involved in the antigen presentation pathway.
What does that mean, practically?
It means the machinery that immune cells use to see and recognize cancer markers. Things like PSMB8, TAP1, B2M. Those genes were turned up in the peripheral blood mononuclear cells, the PBMCs.
So the body's immune cells were getting significantly better at identifying the cancer cells.
That's the interpretation, yes. Plus, they saw an expansion of specific immune cell types known to be involved in anti-tumor responses.
Which types?
Dendritic cells expressing HLA-DR, which are key antigen presenters. Also, T cells expressing CD25 and PD-1 markers often seen on activated T cells, and natural killer, or NK, cells expressing CD25.
Okay, so multiple signs of immune cells gearing up.
Exactly. Clear indicators of immune cell activation. And while it wasn't statistically significant in the serum for this small pilot study, there was also a discernible trend towards elevated levels of pro-inflammatory cytokines like IFN-MOC and IFN-WOC.
Interferons, known for fighting viruses and tumors.
Precisely. Known for their powerful antiviral and anti-tumor responses. So the trend was there, suggesting systemic inflammation might be increasing too.
So here's the surprising twist that really changes how you might think about this. And it's almost counterintuitive, isn't it?
It truly is, because while short-chain fatty acids, especially butyrate, are generally known for their anti-inflammatory properties.
Yeah, we often hear about them being good for the gut, reducing inflammation.
Exactly, and they often are beneficial in other contexts. But their reduction in this specific cancer therapy context appears to be the key beneficial factor.
How so?
Lower SCFA levels, especially from those butyrate producers that vancomycin reduced, might actually promote a pro-inflammatory environment within the gut.
Okay.
And this pro-inflammatory state seems crucial for activating the immune system's response against the tumor.
So inflammation isn't always bad in cancer treatment.
Not necessarily, especially when it's directed against the cancer.
Yeah.
This contrasts sharply with the beneficial role of SCFAs in conditions like autoimmune diseases, where reducing inflammation is absolutely the goal.
Right, different diseases, different needs.
It perfectly highlights the really critical context-dependent effects of these metabolites in cancer therapy versus other conditions.
Fascinating. And the lithocholic acid decrease.
Similarly, the observed decrease in lithocholic acid, that secondary bile acid, may also contribute to a less immune suppressive environment overall, leading to that heightened immune activation we saw.
So what this all boils down to, it's not just about what's present in the gut, but also what's reduced or shifted that can prime the immune system for battle.
That seems to be the case here.
It's almost like the gut has its own secret language for immunity, and sometimes, the usual rules are flipped on their head. Who would have thought that less could actually mean more for fighting cancer in this specific situation?
It's a great analogy, and if we connect this to the bigger picture, the synergy becomes clearer.
That's so.
The vancomycin specifically modulated the gut microbiome, influencing systemic immune responses, getting the body's defenses ready.
Okay, the systemic effect.
While the SBRT, the radiation, directly impacted the tumor cells and their immediate surroundings, potentially releasing tumor antigens.
The local effect.
Exactly. This dual approach seems to enhance immune activation and increase the availability of those tumor antigens.
Making the cancer more visible to the newly activated immune system.
Precisely. Creating a powerful synergy between systemic immune readiness and localized immune responses. Essentially, it helps prepare the immune system more effectively to target and eradicate cancer cells.
It really paints a picture of a coordinated attack.
And the notable improvements in both overall survival and progression-free survival in this pilot study really highlight the immense potential of integrating these microbiome targeting strategies with traditional therapies like radiation.
This study truly challenges the prevailing narrative about antibiotics in oncology, doesn't it?
It really does.
Emphasizing that not all antibiotics have equivalent effects. It really underscores that specificity and precise timing are absolutely crucial.
Absolutely. It's not just antibiotics are bad for immunity. It's about which antibiotic, when, and where it acts.
So what are the broader implications here for research, maybe for practice down the line?
Well, first and foremost, this naturally prompts further investigation in larger patient cohorts. We need to confirm these enhanced outcomes before this could become standard practice.
Of course, replication is key.
Critical. It also opens exciting avenues for exploring the impact on distant recurrences, preventing spread, and potentially applying this strategy to more advanced cancer stages, not just early stage.
Could it work beyond lung cancer, too?
That's another key question for future research exploring this in other cancer types treated with radiation or even other therapies. Furthermore, this approach may help refine how we manage antibiotic use in oncology overall by helping us distinguish immune-enhancing agents, like vancomycin appears to be in this context, from those antibiotics that might genuinely be immunosuppressive. It calls for more nuance in antibiotic stewardship.
That's a really important point.
And finally, what's particularly compelling is that this offers a potentially cost-effective, low-toxicity way to augment cancer therapy.
Because vancomycin and SBRT are already established.
Exactly. By combining well-established, relatively accessible treatments, we might significantly improve outcomes without adding massively expensive or toxic new drugs.
We've seen how a deep dive into just one pilot study can unearth such profound insights. This research hints at a future where our gut health isn't just about digestion,
Far from it.
but a powerful, modifiable lever in cancer treatment, perhaps even a personalized one.
That's the exciting frontier. And it raises an important question for all of us, I think. Considering the diverse roles of the microbiome and its very context-dependent effects, could we eventually see personalized cancer therapies tailored not just to a patient's tumor genetics, but to their unique gut ecosystem as well?
Wow.
What stands out to you as the biggest aha moment from today's deep dive?
That's a truly provocative thought to mull over, personalizing treatment based on gut microbes. Amazing. Keep learning, keep digging, and we'll catch you on the next deep dive.